You can ask them to make a funny face or open their mouth or listen to their heart and they won't cry at you. So examining children and examining adults is quite different. Why do you think you might want to go, if you're a midwife or a nurse or a clinical officer, and you were seeing a baby who is maybe 1 day old, what might be the reasons for going to see that baby and examine it as a routine thing? What can anybody think of while I clean the board? Okay. So, the first thing you would want to think about is thinking about the pregnancy and the delivery. In other words, is there something that we know about the mother? She was taking certain kinds of medicine, or she was drinking too much alcohol or smoking, or had an illness like diabetes or preeclampsia. There was something about the pregnancy, or if there was a problem with the delivery. It was a very difficult delivery and the baby had difficulties coming out. So the first reason, before we actually examine the baby, is we have to think about the mother, and think about the family, and think about if there's anything we know about the pregnancy and the delivery that we need to think about before we examine the baby. Okay? That's the first thing. The second thing is what I would call the granny test. Okay? In other words, the grandmother of the child will come along and go, oh, this is a beautiful baby. And the first thing they'll do is look at it and go, it looks okay to me. Looks a bit too much like the father for my liking, but it's okay. And then Granny will count the number of fingers, count the number of toes, make sure that there's legs, and basically check that the baby looks all right. Yeah? Is that right?
Yeah.
Okay. So there's the granny test. Just having a look at the baby from the top of its head down to its toes. Does this look like a basically healthy baby? Yep. Healthy. Okay? Now it gets more complicated, because now we've got to act like health professionals. There are some things that are harder to spot, that the child's grandmother is not going to notice. And these are things that we need to think about. So, we might want to examine the heart and make sure that the heart sounds normal and that the pulses feel normal. Granny can't do that, can she? No? We might want to look in the eyes and make sure that the eyes look okay, and make sure that there's no sign of a cataract or a problem in the eyes, so we can do something called the red reflex. Okay? Sometimes babies have a problem with their hips, and as in parts of our examination, we should always check that the hips look normal. Now, I think in this country, dislocation of the hips is less common, isn't it? But I think in England, we would always do a test examining the hips. Do you teach the midwives how to do it? Do we teach the midwives and nurses and clinical officers how to examine the hips? Do you know?
The hips?
Yeah.
Over there?
Yeah. Probably not. Okay. I'm going to put that in brackets, because in my country it's very important that we do that. What we do need to do wherever you live is we need to examine the genitalia. Okay? So we want to know that the boys look like boys and that the girls look like girls. Okay? And sometimes the boys will have a problem with the way that the penis has been formed, or the testicles haven't come down into the scrotum. sometimes the girls' genitals haven't been formed normally. Okay, we need to examine and make sure that that's okay. We need to examine the spine. There's a condition called spina bifida, where the spine isn't formed normally, and so we need to look at the spine from the top of the head all the way down to the bottom to make sure that the spine looks normal. Okay? So, if I'm examining a baby, the first thing I do is look at the notes and talk to the mother. The second thing I do is check the baby over from the top of its head to its bottom, just to look, does this child look like a normal, healthy baby? The third thing I do is I examine the things that are harder for non-health professionals to look at. I listen to the heart and feel the pulses. I have a look in the eyes. I examine the hips, although that's less common in this country. I make sure that the genitals look normal, and I make sure that the spine looks normal. Okay? Does that sound like a good start?